I was feeling dizzy, vomiting, and I was weak, sweating, and they tested me. After that, they told me that I have diabetes.
If you are diagnosed with gestational diabetes, your doctor and nurse will advise you on how to take care of both yourself and your baby with simple lifestyle changes. Gestational diabetes causes high blood sugar that can harm you and your baby. So to reduce the dangerous risks, you need to eat healthier foods and take regular exercise.
After testing me, they counseled me what to do, what I have to be eating, doing some housework.
Being physically active for 30 minutes a day is the best way to control blood sugar levels. Being active increases the amount of glucose used by your muscles, so it helps to lower the amount of sugar in your blood. It also helps your body use insulin better. Keeping active can be challenging during pregnancy, as you may not feel like moving around much. If you are not used to it, you should start increasing your activity gradually. Walk more quickly and more often, starting from 10 minutes a day up to 30 minutes. You could ask a family member or friend to walk with you to keep you company. Your doctor or nurse can suggest other forms of exercise that are safe to do during pregnancy. Take care not to exercise on your back, as that could be dangerous. If your heart starts to beat too fast, or if you're taking insulin, watch out for signs that your blood sugar is dropping, such as feeling dizzy or sweating. Every day, you should eat a range of healthy foods from the following groups: vegetables and fruits, lentils, pulses, seeds and nuts, eggs, chicken and fish, milk and yogurt, whole grains and starches such as wheat, rice and sweet potatoes.
Saafunamu kusoomoozebwa kwonna nakimanyiira ne kibeera kyangu eri embeera zange eza bulijjo.
It is important to start the day with a healthy breakfast. This could be a carbohydrate serving like chapati or avocado, along with a serving of protein like milk, yogurt or egg. For lunch and dinner, the plate can be divided up as follows.
They drew for me a plate and the ratio of the food I'm supposed to eat. So half of the plate had to be vegetables, and then 25% protein, 25% carbohydrates.
To eat a lot of portions, sweet potato, chocolate, chips. So they advise me to eat greens, fruits, and to eat a little portion of food.
Try to avoid eating heavily at one meal or skipping meals. It's better to have less food more often, like 3 small meals and 3 healthy snacks a day. You should also have some fruit and dairy products each day. Carbohydrates are foods that are broken down into sugar by the body. Everyone needs carbohydrates in their diet. If you have gestational diabetes, you should choose healthier types of carbohydrates, such as brown rice, wheat, sweet potatoes, and matoke. White rice, pasta, noodles, bread made from white flour, and breakfast cereals are less healthy carbohydrates. You should eat less of these. For the first 3 months of your pregnancy, you should eat the same amount of food as you did before you got pregnant. After the 3rd month, you can gradually add more food to your diet. A normal weight woman should gain an average of 10 to 12 kilograms during pregnancy. If you are confused about what you should eat, ask for help. You may also have the chance to talk to a dietitian.
Diet plays such a big role. So if you understand how your diet affects your blood sugar, or how different foods really affect your own body and your physiology, that's really important.
Many women with gestational diabetes find it helpful to plan and write down all their meals. Try and involve your family in planning healthy meals.
These are basically cereals. Yeah, cereals.
Making changes to your diet and physical activity can be difficult. It can be helpful to start by focusing on one thing you would like to change. For example, taking a short walk each day.
They recommended a 30-minute walk, mostly in the morning or in the evening when the sun has gone down.
Remember to ask for help and support when you need it. Although it can be stressful to be diagnosed with gestational diabetes, most women can manage their condition by keeping active and eating the right amount of healthy food. All your efforts are worth it for a beautiful and healthy baby.